after vacations. So you're welcome. And we hope you are more energetic now. We are taking so many food during the other vacations, and we are fully, what we can say, we are nutritious now, very healthy to go ahead. Before I start the topic, let me remind you a few things. Point number one is that you are having a midterm, because some in the PBL session, while I am working with one of the batches, they were curious to know that about the midterm. So we will be having a midterm, and I will not put this midterm in the heme and immune block, because it's a big block and you have to work hard in that. So I'm shifting from heme and immune to cardiovascular immediately in the next block. So you'll be having that midterm in the, I'll try to have it in the mid of the cardiovascular block, so that there will be less pressure on you. So you'll be having more time to go through the lectures and read it out. And please understand, all the lectures of HIC till that point in time, at the mid of the series, will be covered. So we have to cover all the topics, number one. Number second, it's also to sensitize you that what type of questions and the way the question paper will be framed. So you'll be sensitized and directed that how your final HIC will be like. So that's the purpose. So there are two purposes. Number one, it will stimulate you, otherwise you will sleep on the HIC till the end. Then when you wake up in the morning, you say, oh, we are gone. That's one important aspect. So you will become sensitized to it. The second important thing is that you will also learn that what and the way the exam will be. What will be the format of the exam? So that will be part one. That was one thing which I wanted to tell you, all of you. The second thing is that in this year, as you have yourself formed small groups for research writing. So you are writing a research protocol, or we call it synopsis writing. So you will be distributed among various faculties, and you will have to sit with them, discuss with them about the topic. You, along with the supervisor, will identify the topic. It's not his domain, it's not only your domain, it will be your domain, you and your supervisor. So the group and the supervisor will discuss that's what should be our topic. And you will start writing a research protocol or a synopsis, which you will present at the end of the year. And that research writing and its presentation, it carries certain weightage, marks, grades that will be added to your final exam. So you have, for that thing, you have to work hard for that. So point number two. Point number three is that the department is planning that besides giving you the lectures of various types of designs, that how you carry out the study, there are different types of designs in epidemiological studies, the research which you are going to carry forward from second year to third year. But at the same time, we will be giving you some hands-on training. That means some workshops to all of you. And I believe that workshop, I will try that it should be mandatory for all of you. Because it's not for us, it's for you to understand and then to write. So it will be a mandatory thing for all of us to attend those workshops. And this workshop will be of 6 hours. And all these 6 hours, I will take some of the one block, 1 week of heme and immune afternoon sessions. That was after 2. So in that week, after 2, you will be having the workshop day 1, day 2, day 3, day 4, and day 5. So 5 or 6 hours will be dedicated to that workshop, where you will receive a hands-on training. It will be distributed in smaller groups, and they will be mentored with you, so that you can understand that how we should write a research protocol. That's why it's important that all of you should and must attend the workshop. So anything about that?
No, thank you.
Are you happy to have a workshop or not?
Well, absolutely.
Huh?
Yes.
Majority of you do not speak, so I feel you are not happy with that. Huh? You are not happy? It's after 2. So we are still after 2 only for you, so that you will receive whatever is necessary for you. I want you to equip with all of the potential which you need to have at this point in time to move into the second year, then to third year, and even to carry it out during the internship and PG programs. Because that's what is very, very important. That time no one will be there to help you out about the designs, about writing, about other things you learn today. And then you practice in the third year and second year as well. So that is the purpose, basically. So we'll go to the topic. Our topic for the day is breastfeeding. But before I start, I will ask you, all of you who have put these gadgets before me, these gadgets, have you taken permission from me? Have you taken permission? Huh? Have you taken permission? That's point 1. Whenever you put it, you have to take permission. That is the ethics. Tomorrow you'll be writing in the research protocol, ethical clearance. You cannot carry out any research without a clearance. So, if you need anything from my side, ask for it. Ask for it. That's very important. So, before you do anything, ask for permission. So, we'll be talking about the breastfeeding. The outline of breastfeeding is the varying composition of breast milk. Because immediately postpartum, as we have talked about the antenatal, intranatal and postnatal here. Immediately after delivery of the baby, the composition of milk is different as compared to a female who has delivered 6 months back. So the composition of milk doesn't remain same throughout the breastfeeding period. For example, we have been breastfed for 2 years or 2.5 years. But the milk which we were taking during our earlier life, did not have the same composition throughout. So they have all a varying composition of milk. That means the concentration of different proteins, carbohydrates, fats, minerals, vitamins and other things, they do not remain same, so there is varying composition. Then we also, in this lecture, try to find out what are the advantages. Are there any advantages for breastfeeding or not? And if the advantages are there, good things are there, helpful things are there, what are those things for the mother? What are those things for the baby or child? Then, as the trend has changed, now females usually do not breastfeed. That's what we have acquired from other countries. They are now not breastfeeding their young ones, the babies. Instead, they are giving either the formula milk or the cow's milk. Cow's milk means which you get from the market, Almarai or other things. They just dilute it and give it. Those who are from a lower socioeconomic status. And those of the countrymen who are from the higher socioeconomic status, they go for the formula feed to get the other thing. So we'll see that how does these differentiate with each other. And then obviously the techniques of breastfeeding, and we will also try to understand, based on this, that now most of the mothers do not breastfeed their young ones. What are the implications and the initiative that we create health awareness among populations regarding the importance of breastfeeding. That's called as breastfeeding initiative. So breastfeeding, first of all, we have to understand that when we are talking about breastfeeding, there are two important physiological things. You might have read in the physiology that there is something called a hormone called the prolactin and another hormone called as oxytocin. The prolactin part helps to secrete milk. While the oxytocin, what does it do? So that's called
and also
milk let down reflex. Let down. So it's prepared, then it needs to go out.
Yeah.
So the neuroepithelial cells around the alveoli of the breast needs to contract so that the milk goes out and the baby is able to feed. So these are the two types of hormones which are very important, and two types of this type of reflex like oxytocin reflex or the let down reflex, which we call as milk let down reflex. These are two important things. So on the basis that prolactin helps to synthesize, to produce the milk, but the oxytocin helps it to release from that. Now, the factors that will increase oxytocin release and thereby increase the milk are when the mother thinks of the baby, or whether when the mother just hears the sound of the baby, the milk begins to flow out. The oxytocin comes down and it begins to squeeze the neuroepithelial, contract the neuroepithelial cells. And when the mother sees baby begins to, just as you see capsa, something starts happening here, the watering. In the same way, the mechanism is there, which has been put by Allah, that once the mother sees the baby, it starts to get ready for feeding the baby. And sometimes, if the mother has some worry, she has stress, she has pain, then what happens is that the oxytocin is decreased. When the oxytocin decreases, so the milk let down reflex doesn't occur. So sometimes when you are as a pediatrician or working as a gynecologist, I don't know whether male are here gynecologists or not, I don't know, but in all other countries you have males as gynecologists as well. And they are preferred over female gynecologists, even in other countries. So once the mother comes to you and tells you that she has less milk production, so you have to understand these factors which might be responsible at the time when you are giving counseling to the mother. That's why it becomes important to understand now that worry, stress, pain, and doubt that may lead to decreased oxytocin, decreased milk let down. So as I said, the milk composition, it differs. So you have different phases, like you have colostrum. It's a different composition. Then there is a transitional milk, and then there's a mature milk. So actually there are only three: the colostrum, the mature milk, and in between is something called as the transitional period, a period of varying composition, and the composition of this transitional milk should be between the colostrum and between the mature milk. So the mature milk and the colostrum are different entities as far as concentration or the composition is concerned. Then we have also the foremilk that comes first, hind milk that comes end of the breastfeeding, and then we have also another thing called premature milk. What's this premature milk? Premature milk. It's written here. So you have certain deliveries which occur prematurely. When they occur prematurely, the milk is not produced as it's produced in composition vis-a-vis to normal ones. So it definitely should have a different composition as compared to the colostrum or the transitional mature milk in a normal delivery. Preterm. So what's preterm? Delivery which occurs before the time span, normal time span. Okay, so this is a preterm delivery. So again, when we say milk production up to the period and milk production before that period, so the composition will be different. That's what we are talking about. Preterm and term. So colostrum is the first milk. It's thick, it's yellow, it's highly nutritious for the baby. Its production is very small quantities. You see that this production is very small quantities per 24 hours. But the important thing is that it's rich in very compositions, like it's rich in proteins. Because you will see, what's your protein requirement, by the way?
What?
Protein requirement per day for you. How much? How much proteins you need to maintain? What's your weight?
100.
What's your weight? From 80. For example, his weight is 80. So how much proteins he need per day to maintain that 80 kg? Do you have any idea? Yeah? 100. 100, okay. Any other? Abdul Majid, how much you need? So to maintain, if he has to maintain his body weight at 80 kgs, he needs 1 gram per kg per day. 1 gram per kg per day. So how much he needs now?
80.
80. If he puts, as you said, 100, then what will happen? So he will increase in weight. But as far as the babies are concerned, because they are in a phase of rapid growth, they need more proteins as compared to us who need to maintain only.
Yeah.
So for that thing, it's already in that guidelines of Allah that the mother itself produces more proteins for the baby because he's in the developing phase, he needs more proteins. So what are the proteins now? 2.3 grams, but it has less carbohydrate because more important is that we need to build our body, so that's what happens. And this milk is usually between 5 to 7 days. And after 10 days, the other milk begins to flow. So the composition here is that, as you rightly pointed out, that it has a rich amount of antibodies. But the most important antibodies are the IgA. What are the IgA? Yes, mister, just look at the person. What's important on the mobile, mister? What's important on this? You either put it out or I will throw it out. And I will send you outside.
I'm sorry.
Okay. So, what's important about IgA?
From infection, increases immunity.
What's the difference between IgA and IgM? You have read it. Huh? What's the difference? Any difference between IgM? Any difference between IgM and IgA? You have read the antibodies? About antibodies you have read or not? Huh? You have read it in physiology, immunology. So IgA antibody is called as surface antibody. It is usually present on the surfaces. As compared to IgM, IgG, they are present within the system. But this is present on the surface. That means once you open your eyes, the surface which is there and the fluid which is there is also rich in antibodies. But which type of antibodies?
IgA.
Similarly, your mouth, your lungs, your gastrointestinal tract, they also have antibodies, surface antibodies. And these surface antibodies are called as IgA antibodies. And when they are at the surface, and it's rich in that, it helps to prevent the baby from any type of allergic, any type of infection. They start there. Although you divide the immunity into 2 parts, innate immunity. There's the lining, the skin, the mucous membrane, and then there's other type of immunity which contains antibodies and cells. So you have differentiated 2 things. So when it's rich in IgA, it prevents against infections and allergy. It's very important. But most of the developing countries, the females, what do? They don't give the breast milk. This breast milk, which milk? The colostrum part. They throw it away. Take it out and throw it. This is not necessary. So that is why once you have to talk to a female or talk to a couple regarding breastfeeding, you have to understand that how important this colostrum is. Because there may be cultural habits associated with it where the society actually do not use colostrum but throws it away. So that's why the baby is coming to you all again and again and again with respiratory tract infections, with allergies, with so many infections. So that's why we have to understand it. It also has a purgative action. That's not laxative action. Now why is it important to have a laxative action? Because the GI mortality, it helps to improve the GI mortality. You know there is meconium within the tract, it wants to clear that up. Then we'll talk about it. It reduces enterohepatic circulation and clears the meconium and prevents NNJ. What's NNJ? No. You have read in physiology, neonatal jaundice. Have you read it? Yes, I have read it. Yes, I have read it. It's neonatal jaundice. Why does neonatal jaundice occur? Why does this occur?
increase in
Huh?
forgot.
Because these are fetal RBCs. Now, when they move when the fetus moves out from the womb to the external, there's increased destruction of fetal RBCs. Number one reason. Second reason, because the baby is in the womb, the concentration of RBCs is more.
Okay.
So the destruction will be more.
Yeah.
So these are two reasons. Third important reason is that the baby is developing, so the liver enzymes are not to that extent mature enough to conjugate those bilirubin so that it will become water soluble. So it remains within the body. So this thing helps to clear up this neonatal jaundice, and it prevents the neonatal jaundice by decreasing the enterohepatic circulation, because it's a laxative, it pushes out. Because if you go for an enterohepatic circulation, then it continues to remain for a longer period of time. Number one. Number second, by the way, what is bilirubin? Anyone from you? What is bilirubin? What's your name? No. Saleh, yeah. I know, but forget it. So Saleh, what are the reasons? What's bilirubin? How does it come? You don't know? Anyone? Again, we go to the physiology and biochemistry when there is heme metabolism. When the RBCs are getting destroyed, then the hemoglobin is left behind, then the hemoglobin is again processed through biochemical ways, and then this bilirubin becomes conjugated with the help of glucouronic acid. It gets conjugated, then it becomes water soluble and moves out. Okay? So you have to understand why from the bilirubin is coming and other things. It also contains growth factors which help to intestines to mature, prevent allergy and intolerance. And I said vitamin A is rich and reduces severity of infection. Again, you have read the vitamin A. You have read it in the first year. Now, what is vitamin A? It's also called as it prevents
Infection.
It's anti-infective vitamin. It's also called as anti-cancer vitamin.
Anti-cancer?
Anti-cancer vitamin as well, because it protects the epithelia as such. When it protects the epithelia, it prevents it from becoming malignant. So this vitamin is also called as anti-infective vitamin as well as anti-cancer vitamin. So if anybody talks that there's an anti-cancer vitamin or anti-infective vitamin you are getting in the Saudi board exams, you start thinking that we have never been told about that. So you should know that why it's important to understand all the alternative terms as well. Then it's also antibacterial properties in terms of lactoalbumin and lactoferrin, and it's rich in cholesterol, because now myelination of the nerve cells start taking place. So that's why, again, the cholesterol is very, very important. It has sodium, potassium, chloride, zinc and copper, all of which are very, very necessary. And the milk also contains the leukocytes, which are macrophages and lymphocytes, helps to prevent any type of infection. So that's why it's very, very important. If a child is breastfed, the chance of having diarrhea, respiratory tract infection, they drastically decrease. But if the child is not breastfed, then there are more chances. The baby has repeated attacks of diarrhea, repeated attacks of respiratory tract infections. So that's why the importance of breastfeeding is very big, crucial. Then, as I said, the transitional milk is the milk between colostrum and the mature milk. And usually it's between 4 days and 10 days of postpartum. So there's an overlap. So you need only to remember that it's a transition from the colostrum to the mature milk. And as I said, as far as its composition is concerned, it's also intermediate. The composition of the various ions, the various minerals, the protein composition is also in between the colostrum and the mature milk. but the volume increases. Because the volume there was very less, now the volume starts to increase. Then the mature milk, when we talk about, it is produced from 10 days onwards till the termination of breastfeeding, till the mother stops breastfeeding. So whatever breastfeeding we have got, or the baby is getting, that's as a mature milk. So mature milk on average, how much energy it gives? For energy, you need energy. Because ATP is called as the energy currency of your body. You have reals as currency when you go anywhere, purchase things. But when our body works, it also needs some currency. And ATP is called as currency, energy currency. And it's usually produced from glucose.
Yeah.
You have to know all these terms. No? You come across, it's in your books, but you don't read books, unfortunately. So the energy is 750 kilocalories. And the lipids, triacyl, cholesterols, phospholipids, you have read in this biochemistry, and fatty acids include essential fatty acids and cholesterol, all of which are very important for the nervous system. As far as the proteins are concerned, proteins are divided in two parts, casein part and the whey proteins and casein proteins. Casein proteins is just like a curd. You get the zabadi, that's a curd. And if you put it outside, there's also some water which generates above on top of it. So that curd part is the casein, and upper part is the whey protein. Now we'll see. So proteins with low solubility, complex with calcium, much lower concentrations than in cow's milk. So otherwise what will happen? This casein is in lower components or lower concentrations in the breast milk. So it will not complex with the calcium. Usually when you prescribe any person calcium tablets, you don't prescribe him take them after foods or with milk, because it will get complex with milk. So it will not be ready for absorption. That's why it's important that it's very low concentration in the milk, in the human milk, so it makes calcium more available. Are you getting my point or not? Proteins with low solubility which complex with calcium. If it complex with calcium, the calcium is not available for the body. So, but the concentration is very less as compared to the cow's milk. So if you give cow's milk, what will happen? The calcium component will be less absorbed by the infant as compared to the breast milk. Then the whey protein is the largest component. They are alpha lacto, as I said. These are all almost enzymes or antibodies. It is a clear field left behind when clotted milk stands. So that's the zabadi, and on top of it you have the water. So the water part is where we have the whey proteins. Then other things which it contains is the non-protein nitrogen, that are peptides, dermal growth factors, and insulin and somatostatin C. And they play an important role in the immune system. They are directly absorbed. The point here is about these non-protein nitrogen is that these chains are directly absorbed and is used to develop antibodies and other defense systems for the body. Then we have another thing is called as lactose. That 70 grams is the major carbohydrate in breast milk. So you have to understand, when you see lactose intolerance in biochemistry, you immediately understand how much we have in the milk. And in those people who have those lactose intolerance, usually breast milk is withheld. It's composed of galactose and glucose. First chapter, biochemistry, as far as carbohydrates is concerned. Isn't it? Or not? In year one you might have read, I don't know. Then the cations, those ions which are positively charged, cations. So what are the sodium, potassium, calcium, magnesium, all of which are important for the body, they are present there. But as far as iron is concerned, iron is very less. Iron is very less in breast milk, but the percentage of iron absorption from this very less is high. That even if it's less, but its absorption is very high. That makes it different from cow's milk. Then the other components or the other minerals are the zinc, selenium, chromium, magnesium, all are present in small amounts of the breast milk, which the person needs. Vitamin K is low in breast milk. That's why every person, all of you, when you were born, you received an injection of vitamin K. Give an injection of vitamin K. Why is it there? Because once the baby will be put on the vitamin K, then vitamin K dependent clotting factors, read in physiology. Vitamin K dependent clotting factors. Isn't it? You read it. Now you are recapping it. So, in a newborn, it's not there. Vitamin K is present in lower concentration. That's why all of you receive an injection of vitamin K at the time when you are born. To prevent what? To prevent hemorrhagic disease in the newborn. Because the clotting factors, vitamin D dependent, vitamin K dependent clotting factors, lesser. The vitamin D, again, the vitamin D content of breast milk is less as compared to vitamin C. We'll see once we move ahead. Then there is hind milk. That's the milk that comes once the baby sucks the milk. The milk which comes at the last is called as the hind milk. So these are called as forelimbs. These are called as hind limbs, isn't it? These are forelimbs which comes first. Which comes last is the hind limbs. Similarly, you have foremilk which comes first. Then you have hind milk which comes last. So this last milk which the baby takes, fats and lipids are high at the end of feeding. That's called as
So what about for milk? For milk.
Foremilk is the first which comes first. When the baby sucks the first milk which comes, it's called as foremilk. And then he continues like when you start feeding,
Yes.
that's called as the forefeeding. When you end towards the end,
Hind milk. Hind milk.
you do all the things, right?
Yeah.
Isn't it? Which is
Hind milk, yeah.
that is the hind feeding. Got it?
Gotcha.
So similar to the baby when it starts, it's called as foremilk.
That's fine.
End is called as the.
Yes.
Very easy, not difficult. It's more a common sense. All science are common sense. It doesn't need any rocket science. Then the preterm milk. Now, important, this is very important. Now, if you encounter during your counseling, you have females who have given birth to a preterm, now their composition will be different. So it is more in protein nitrogen, immunological factors, it's more because Allah already knows that one is a baby is premature and he needs more protection. So it's produced immunological factors more in that. Medium chain fatty acids, sodium, chloride, iron, this differentiate lasts only for 4 weeks. After 4 weeks, the milk becomes mature milk.
Sure.
Yeah. Sure. Go. Otherwise you will spoil shit. No, you can go. But it has less calories, proteins, calcium, and trace minerals. They are less as compared to the protection which it needs. Allah has given more protection to the preterm. Now see, this is the difference. You see, energy is 70, as I said. Proteins 1.3, huge proteins. Protein overload. Fat is 4.2, lactose is 7, more as compared to other ones. Vitamin D, almost same, no difference. This is buffalo milk, human milk, this is buffalo and this is cow. Because buffalo you don't use, but at least some may use this cow's milk when you go to get what that's called as halib. Halib is sometimes used, or a formula milk. So when you talk about halib, you are talking about this cow. So you should know what is the difference and what is the difference.
But it's very rich, buffalo milk. It's very
It
rich.
doesn't- but the baby doesn't need that much. It will be an overload. There will be solute overload. You'll see.
Okay.
You'll see forward what happens. Vitamin C is 3.8. It's less. Vitamin B, calcium, 35. There will be solute overload. These are solutes. The baby will not be able to handle those solutes. The kidney, it has to work to get rid of excess. So it cannot work. Similarly, folic acid and iron. You see the iron is 0.08, very less, but the absorption of iron
It's very
is
high.
very high. That's the difference.
Yes.
Water, everywhere water, even in the world, 75% water. V, 75% water. So human milk, more water there. Cholesterol, retinol, sodium. You see now the sodium again. It is to the extent which the baby can handle. And this is more, the baby cannot handle it. Potassium and phosphorus. Now, if you see calcium and phosphorus, they are in a different composition. You know, bone formation, again read in physiology, that calcium and phosphorus, they form something, complexes that are very important for bone formation. But here, the potassium is low, so the free calcium is more. If the potassium will be high, then the calcium component will get lower in the blood. So there will be hypocalcemia. So because Allah has already given us a less amount of potassium, it prevents the neonates to undergo or to follow hypocalcemia. It doesn't happen because the phosphorus level is very less. So the complexion, formation complexes, the calcium is less. Now, these are three types of reflex which usually occur. One is called rooting reflex. If you put a baby even in your lap, he will start searching for your breast, even though you don't have one, isn't it? I know you don't have one, but the baby will start searching for that. That's the rooting reflex. Then there's suckling reflex, when actually it begins to suck. And then there is swallowing reflex. All of you have, the baby also have. So these reflexes are very important. Read in, again, physiology. Read in physiology, so no discussions. Now, what are the advantages? The most important advantage is that it's economical. You don't have to pay something to the bakala for halib. You don't have to pay something there for a formula feed. It's ready-made feed. Yes. And the most important thing is, it is at the right temperature. It's at the right temperature, which is needed. Otherwise, you boil it, then you try to cool it. Here, nothing has to be done. So you just give. And it's very convenient. You need not have to prepare it, how much water I have to add, how much spoons of formula milk I have to add. And more importantly, it's balanced diet. It's anti-anemic, absorption well, anti-allergic, vitamin A, antibodies there, anti-rickety, calcium, more, phosphorus less, and vitamin D also. Anti-infective, as I said. So these are all advantages of breastfeeding. So these are the advantages for the baby. That's why we talk about advantage of the baby, advantage of the mother. So as I said, it's a balanced diet. So you can say that proteins, 70% soluble, easily digestible, fats are there, high cholesterol is there for myelination of the nerves, then there's a higher lactose, cholesterol is there, low phosphorus, as I said, low phosphorus prevents neonatal hypocalcemic convulsions. If the phosphorus is more, then what happens? It complexes with the calcium. How does calcium prevent convulsions? Calcium is called as the stabilizing ion. Read in physiology while you were talking about the action potential. You were talking about action potential in physiology. There you have seen that when the calcium is near the ATP channel, it increases the potential. So you need more energy to depolarize that cell. If calcium is removed, then you need less force to activate it, to activate those channels. So it acts as a stabilizing ion. So as we said, that low phosphorus is there, calcium is at a good amount, it prevents those convulsions. Lower risk of iron deficiency anemia. First 6 months you need not to give anything other than milk. First 6 months, exclusive breastfeeding. Nothing water. It contains, as I said, sufficient amount of water in it. Higher iron content more than the cows. Better absorption. Then anti-allergic, I will not go into those details because otherwise we will miss many important things. So we have already talked about all these things, that how it helps a baby to prevent of infections and allergies. Anti-rickety. So it is vitamin D as well as calcium phosphorus ratio is 2:1 here. So that's why it helps to prevent from neonatal hypercalcemic convulsions. Higher lactose enhances calcium absorption from the gut. That's the importance of higher lactose. So biochemical proteins, we talked about the whey proteins and the casein. The whey protein is the most important, 80%, and it gives you those immunological proteins which helps in protection. Non-nitrogen, we said that non-nitrogen proteins are also rich. They go directly into the bloodstream and help in development of the antibodies. So they have the double mechanism, double protection for the baby. Solute load is low, which we are talking about. Solute load in case of cow's milk is higher, in case of buffalo milk is higher, but it's low. And this lactose also improves the absorption of calcium lactate. Microbiological concepts, so microbiology, you can see that there's lactoferrin, there's bile salts, human lipase, and there's lactose and bile factors, all of which are very important for the survival of the infant. Immunological safe. The immunological composition is that it's safe. It's not allergic. While as you may get allergy from cow's milk, you may get an allergy from the formula feed.
Yes.
But here you don't get any type of allergy. So it's non-allergic and it's safe. Also containing lymphocytes and secretory. That's why it secretes IgA, surface antibodies. Again, I want to encapsulate things. And T lymphocytes as well as macrophages, all of which are very important in protection of the newborn. Now this is very important. It's called as psychological factors. So whenever, nowadays parent and the child relationship is not so strong as it used to be previously. If you see your forefathers means grandfather and grandfather, you see they were very closely knit. Because they were not using those cow's milk, they were not using those lactose, but they were exclusively going for the breastfeeding. So there was an emotional bond between a baby and the mother. And this emotional bond lasted long. Now you see, homes are coming up, so many things are coming up. Why? Because this emotional bonding has been broken now. This is being damaged. Mothers are opting for formula feed, mothers are opting for other things. So there is no such emotional bonding between the baby and the mother. Maternal benefits. So we were talking previously the benefits to the baby. Now, what are the benefits to the mother? As we read in the previously, that it helps in involution of uterus immediately. Immediate effects. If you start giving breastfeeding the baby, the uterus begins to involute. Because oxytocin comes up and it involutes. It helps in involution. Then it also decreases the risk of breast cancer as well as the ovarian cancer. You might have read, you might be reading in the pathology part what are the risk factors. One of the risk factors is those who are nulliparous, nulliparity. And second, those who do not breastfeed. So that's why you just contrast that means prevents all the things. Epidemiological part. That all those babies who are breastfed have lower chance of diarrhea, lower chance of ARI, acute respiratory tract infections, and overall risk of infections is lower, 2.8 times lower, as compared to those infants who are not breastfed, who are being formula fed or being fed on cow's milk. So techniques, I think all of you know these techniques. Do I need to again? The first important thing is that you need to wash the nipples, the mother. You have to explain the mother to wash the nipples and hands. The hands should be warm. The baby should be clean. The baby should not be wet. Mother should be relaxed. That's why even in the beginning I started that there should be no stress, pain, and other things. She should be relaxed so that the letdown will be more. And support of the breast during feeding. So supporting the breast during the feed. So what are the good positions? Good position is that the baby's body should be as close as the mother's body. Second, these are criteria for good position. Please understand. Then there is criteria for good attachment. So this is for position. What should be the position of the baby? Position should be, the baby should be, so the buttocks are here, and the line is like this. The head is a little bit tilted backwards, and the baby's abdomen, it touches the abdomen of the mother. baby's whole body is supported, not the neck. Sometimes you only support the neck, but whole of the baby. So baby will be like this. The buttocks of the baby will fall on your left hand or on your right hand. Baby's neck is straight or bent slightly backwards. That's the good position. So if I ask you that what are the good positions, so you should understand that what are the good positions, what are the points in the good position. And good attachment, when you talk about attachment, you see the chin, it's touching. The lower lip, it becomes everted during breastfeeding. Then the areola part. So baby's mouth is widely open, baby's chin is touching the breast, more areola above than below in the mouth. So almost more areola,
Yeah.
which surrounds the nipple, more of it is inside the baby's mouth as compared to the lower part. No pain while breastfeeding. There's no pain while breastfeeding. That's very important as far as good attachment is concerned. This is the right position and this is not the right position. So while you are counseling a mother or a couple on breastfeeding, you should know that what you have to talk and what you have not to talk. What are do's and don'ts in breastfeeding. So, but criteria for adequate feeding. So when we say that the feeding is adequate, when baby is fed at least 8 times per 24 hours, baby is calm and satisfied after feeds, doesn't cry, he sleeps well 2 to 4 hours after feeding, so there is no disturbance to either of the members of the family. Normal motion, no constipation, so the bowel movements are also normal. Normal amount of urine is produced and the weight gain is normal. That is when we say that this is criteria for adequate breastfeeding. Now this another thing is called burping. Burping, you know, and many of you are even experiencing it today, that once the baby takes the milk, swallows inside, it also swallows some amount of air with it. So the air has to come out. So what you do, place him here and just rub the back or give a slight pat on the back so that this air moves out. Otherwise, when it will move out, it will take milk along it.
Yeah.
Just when you open a Coke. So the gas moves out, it takes some Coke and it spoils spoils our clothes. So same way, when the baby has the air inside, so you need to, so what you do, you place the tin on the table for a couple of minutes and you very easily remove it. Same happens here. So baby is put here, on the mother's shoulder supported, right arm supports the buttock, you can see, and gently pat on the back. Just give a pat or just rub it, the air will come out. As I said, that most of the women do not breastfeed now, so there is an initiative that's called as Breastfeeding Initiative. This was initiated by UNICEF in 1992. It's an organization, but I also worked with the UNICEF, United Nations International Child Emergency Fund, working all over the world. And World Breastfeeding is usually celebrated in the first week of August. So even you can start awareness program every August in the first week and encourage mothers to breastfeed their young ones. Now we should also know that what are the absolute contraindications. Congenital lactose intolerance, as I said, that there is congenital some enzyme deficiency, you may have to withhold breastfeeding. Galactosemia, phenylketonuria, again related biochemistry, so you need not to give breastfeed. Intake of anti-malignant drugs. Mother is taking anti-malignant drugs, the breastfeeding is contraindicated, so no breastfeeding. And anti-thyroid drugs, again with the thyroid you have seen that the mother is taking, stop breastfeeding for that period. And antipsychotic drugs, in the CNS you'll be reading about the antipsychotic drugs, and there breastfeeding is contraindicated with that. So when you will start artificial feeding? Not every time. You see, when mother is critically ill, not able to breastfeed, mother is unavailable, or the mother is dead. So you have no other alternative than to start milk. This is called as the artificial feeding. This is suffice. So if I'm talking about an assessment, SEQ, I can say what is colostrum, its composition, or what is the mature milk and its composition, isn't it? Or what is the composition of the transitional milk. I can also be talking about the breastfeeding advantage to the mother, advantage to the infant. So you should understand what are the advantages to the mother, what are the advantages to baby. Then what are the difference between cow's milk and breast milk? So you need to know the composition of each of these, what the cow's milk contains more as compared to the human milk. Then absolute and related contraindications for breastfeeding. When we will counsel a mother not to breastfeed, what are the conditions? Then criteria for good attachment, good positioning in breastfeeding. Then we can say that what are the microbiological aspects of breastfeeding and so many things we can ask as far as different questions are concerned. We may also ask so many MCQs out of this. Oh, you can get a wide range of MCQs and any SCQs on this. I think if the subject is very clear to you, it's very easy to write these details. Thank you very much.